Good evening, everyone. My name is Corinne Bush, and I'm the Executive Vice President of the Board for Certification of Nutrition Specialists. The BCNS is proud to partner with the American Nutrition Association, the ANA, in their ANA Lecture Series. The American Nutrition Association is very pleased to be hosting Dr. Suhas Kshirsagar to discuss fasting and Ayurvedic perspective. Let me take just a moment to tell our audience about the ANA. We are a nonprofit organization which for over 40 years has been on a mission to promote optimal health through nutrition and wellness education. We educate the public and professionals in many ways, including hosting world-class nutrition programs such as this one tonight. We encourage all of you listening this evening to visit our website, theana.org, for an abundance of nutrition information, resources, and upcoming webinars. Join the ANA as a member and help us continue to bring these nutrition luminaries to you. The ANA would like to thank Now University for providing the technical assistance that allows us to present our webinar series. Find them at nowuniversity.com. And now we are honored to introduce Dr. Suhas. Dr. Suhas is a world-renowned Ayurvedic physician and educator from India, born of a traditional Rig Vedic family. He holds an MD in Ayurvedic medicine with a gold medal from the prestigious Pune University in India. Dr. Suhas is one of the most academically accomplished Ayurvedic physicians in the United States who has traveled worldwide popularizing Ayurvedic medicine, setting up clinics, offering courses for both medical, professional, and laypersons, and has provided Ayurvedic consultations for thousands of patients. He is an internationally acclaimed motivational speaker and a visiting professor at various Ayurvedic schools and universities worldwide. He is an advisor and consultant for the Chopra Center. He was featured in numerous radio and television shows like Dr. Oz, NBC, and many more. He is an experienced clinician and an insightful Vedic counselor who adds tremendous value to his clients and students alike. He is an internationally acclaimed researcher, best-selling author, formulator, and consultant to various nutraceutical companies. He is currently the director of Ayurvedic Healing, an integrative wellness clinic in Santa Cruz, California. Dr. Suhas will answer a few previously submitted questions at the conclusion of his presentation. Welcome, Dr. Suhas.
Thank you, Corinne. Thank you. It's a pleasure to be here with you and your audience, and a great honor to be a part of this premier organization, which is responsible for educating our global community on the connection between nutrition and health. And especially the topic that we are going to discuss about today is something which is very close to my heart. And being a clinician, I have seen over the years very closely that food can bring us happiness, and also bring a lot of unhappiness in its own way. So we are going to discuss one of the most ancient technique that is known to humanity, especially from an Ayurvedic perspective. And Ayurveda, as we all know, is one of the most ancient and most comprehensive system of healthcare that is known to humanity. And if you look at all the cultures, all the ancient cultures around the world, for over a millennium, we have been using fasting as an excellent healing therapeutic modality. And we're going to look at the benefits of fasting in so many different ways, and especially the benefits from a psychological, physiological, and spiritual perspective, that what is the exact effect and the impact of fasting, and how can we cultivate it to become a part of everyday living, and we can change our relationship with food and so many other ways by using this very simple technique. And I really like some of these low-tech interventions, because where we are currently right now, we are into a situation where we believe in spending a lot of money on healthcare, where gadgets, equipment, surgical interventions, tools, drugs, many of these things cost a lot of money. But something like this, which is low-tech and having a broad spectrum benefits, and I see this a lot in my clinical practice. I wrote a book called Hot Belly Diet based upon this concept of reigniting your fire. And what we noticed was when people were feeling light and bright by staying away from food at certain time, they were actually reigniting their passion for life. So fasting is an age-old technique. From an Ayurvedic perspective, the word that we use, and it's a very pronounced, prominent healing technique called as Langhana. Langhana simply means to fast. In medical terms, the word fasting can simply be defined as voluntary abstinence from consuming food for varying lengths of time. There's no fixed time that everybody should stay away from food as such. Fasting is used as a therapy for several medical conditions. It's also a vital component of ritualistic and spiritual practices in many religions. And that's exactly the premise of today's talk, where we are going to really understand when Ayurveda says Langhanam Param Aushadam, and this is a Sanskrit quote, and Sanskrit is the most ancient language that is known to humanity, as I say. When it says that it is one of the most healing modality that one can practice, and it actually bridges the gap between the grosser part of the physiological functioning to the inner and the subtler aspect of your mind, senses, and the sensory functioning. When you look at Ayurveda and yoga as sister sciences, actually the healing therapies should bridge the gap between the body and the mind together. So when you fast, you're actually bridging this gap very easily and very clearly. So Langhanam Paramam Aushadham, it simply means it's one of the best healing technique. And the most important thing is when you fast, the body knows exactly how to heal itself. So the question that we need to ask ourselves, what exactly is fasting and how do we define fasting? Simply put, fasting is the abstinence from food for a spiritual breakthrough. And I would like to highlight this word because in medicine, we kind of shy away from spiritual understanding. But at the end of the day, this is all a consciousness-based technique. Ayurveda is a consciousness-based approach to health. And we have a firm belief in Ayurveda. And the motto of Ayurveda is Ayurvedo Amritanam, which simply means Ayurveda for immortality. So health is a byproduct of enlightenment. And this is a technique through which you are having a spiritual breakthrough. You are actually having this feeling of awakening, ultimately getting to know yourself better. The Sanskrit word upavasa simply means to be close to yourself. So when you are close to yourself, you're actually able to really ponder, think, understand everything about life. And Ayurveda, in fact, is the science of life. So when we use fasting as a technique to know yourself better, we actually use this for so many different ways. Fasting is often seen as abstinence from some form of gratification for a period of time in order to achieve greater spiritual purposes. And it can be fasting from food, it can be from sex, alcohol, coffee, certain foods. You can eliminate certain foods, social media, electronics, speech. You can go on silent retreat. So when we use the term fasting, is trying to stay away from, in order to cultivate discipline and willpower, to stay away from things which are not good for you, and allowing you to remind things that's something that you can live without. And I think especially in the modern day and age when our life has become really fast-paced because of social media, cell phones and Wi-Fi and electronics and everything, we talk too much and we communicate too much. So at times going into a kind of an inward journey or an inward curl is really, really good. And medically speaking, physiologically, what happens during the fasting is exactly what we are going to discuss. Fasting is like a reset button for the entire physiology. It's not really mystical or magical. Therapeutic fasting is something is really prominent because it works. The body has the ability to heal itself. And we always believe that your body is really, really intelligent. It knows exactly what to do when. And when we give our body a chance to heal itself, I think that's the most important message that we want to share. And the reason why we want to talk about it, when I compare the current statistics and everything, we see it's the world is completely polarized. Half of the world is overfed and undernourished, and the half of the world is kind of undernourished and impoverished. So 50% of the world population is eating too much, and 50% of the world population doesn't have enough to eat. Especially in the developed countries, we have some very scary health statistics. Especially in the United States, we have about 2/3 of our adults which are overweight. About 33% of them are actually obese. And these rates have tripled with the industrialization of the food since 1980. So in last 20, 30 years, the rate has tripled. Certain populations are really feeling the impact of these high cost of cheap foods. 79% of African American, 73% of Hispanic American women are overweight, and about 30% of U.S. kids are overweight. So we are definitely eating bad foods, and that's one real reason why we really need to understand what we eat and when we eat and how we eat. Diabetes, as my friend Dr. Hyman says, that is going to be in every other adult over 40 years of age. All overweight people have double the risk of stroke, cancer, and coronary artery diseases. So I think we are reaching to a state where we have to look at our food, what we eat, and how we eat. And so when we try to fast and observe fasting, what it does, it allows the body to reignite the fire or the agni or the heat or the metabolic function to start burning the unwanted fat and allow you to feel light and bright. So as I said, we are overfed and undernourished, and the American Diabetes Association reported in 2015 that almost half of all Americans have either diabetes or prediabetes already. Many other diseases are associated with obesity and diabetes, like metabolic syndrome, hyperlipidemia, coronary artery disease, high blood pressure. They are all on the rise, according to National Institute of Health, National Heart, Lung, and Blood Institute. We are getting sicker and sicker because of overeating, while the science is showing that caloric restriction can have the effect on reducing harmful levels of body mass especially, improving insulin resistance, glucose regulation, and can even extend longevity. So when we talk about real low-tech intervention, this is exactly what we're talking about. We're talking about just looking at the midsection of your body where you're carrying some spare tires around your belly. We don't have to look further. We don't have to even run the battery of blood test or anything else. By just looking at your body, we can safely predict that whether you are having a tendency toward cardiovascular disease or some type of cancer or diabetes, asthma or breathing difficulties, low back pain, infertility, erectile dysfunction, sleep apnea, inflammatory arthritis, and chronic GI disorders where you are intolerant to certain foods. Any food you eat makes you feel gassy, bloated, and doesn't make you feel really good, makes you feel sleepy, sluggish, and tired. So I think these are all signs that your body is carrying something excess in which it's unable to function. So by just looking at your body, you can safely understand and predict what is going on in the system. And the reason why we talk about fasting in the light of, from an Ayurvedic perspective, because Ayurveda defines diet, what you take in from any field of perception, from any mode of intellect. This is something what you ingest. We are talking about food, water, and air. These are the three most important things that anybody would need to live. Air is the most important thing. You cannot live without that for some time. Water, you can get away without water for maybe a few days. But with food, you can live really happily and long time. So the most important thing for living well is air. Second more important is water, and food is the third and the least important in this scale. And importantly, along with these three things, we're talking about emotions, information, and thoughts that we ingest. So when you're fasting, you're actually having this connection of air and water really going into the system. You're processing your emotions, you're looking at the information that is stored, and regulating your thought process, in which you're getting a spiritual breakthrough. So staying away from food and drinks during those times is something going to cultivate that ability to really connect to your own self. And there's a greater difference between how we look at nutrition from an East and West perspective. There's a difference between conventional and Ayurvedic nutrition as such that from a conventional nutrition point of view, we always ask that why we eat is based upon what you want to eat, your personal preferences, habit, body image, emotions. You're looking at the calories. Sometimes you even count calories from different food groups, that how much carbohydrates, how much protein, how much fat, how much fiber. You're looking at different balancing food ingredients coming from vitamins and minerals, depending upon the food groups that we just now said. And the goal is you are what you eat. But from a Vedic Ayurvedic perspective, food is information. It contains prana, or the force of life. So we are looking at the food which is filled with prana. So if you're eating food which doesn't contain the life force, it's going to take a toll on your system. The food should contain all the natural qualities from a God-made perspective, I would say. So you're eating more God-made food, not man-made food. You're allowing the body to process what we eat properly. Your eating is based upon your individual constitution, understanding who you are and what you do. Your diet is totally based upon your body type or body-mind type, and you are using all the different 6 tastes in your food, and instead of just eating what you eat and what you become, is you are what you digest. So I think there's an age-old Ayurvedic saying that we always say that to eat is human, but to digest is divine. And so I think when we are looking at fasting as a concept to reignite the spark and the passion for life, you're actually getting rid of impurities. So when you embark upon fasting, and the reason, and I have so many patients that I encourage them to fast, because they come with a toxic body. They are having symptoms of being overweight, they're feeling fatigued, having headaches for no reasons, having multiple food cravings, allergies, frequent illnesses, digestive problems, intolerances to certain foods, coating on their tongue. And this is an age-old Ayurvedic concept of looking at the coating of your tongue. Mood swings, skin problems. These are all signs of a toxic body, and that's one of the main reasons when you start fasting, you actually reignite your digestive power and you open the pathways of circulation, communication, lymphatic circulation, lymphatic return. Everything feels light and bright and open. But when the channels are completely clogged at the cellular level, at the vascular level, and there's an accumulation of residual digestive impurities called as ama, which is a toxic residue, then the channels get clogged, and in turn, it actually makes your digestive fire even more weak and sluggish. So I think if you really learn and understand how to fast for yourself, you can really change this clogging of the channels to really opening of the channels where the intelligence freely flows to all the cells and tissues, and you're feeling really good. I see lots of people who are having these levels of ama where there's a toxic accumulation of these digestive impurities, having bad breath, coated tongue, dull appetite, delicate digestion. No matter what they eat, they feel sleepy, sluggish, heavy and tired. Sometimes incomplete elimination, irritable elimination, either it's too soft and loose stool or they're constipated, generalized pain for no reason in different parts of the body, feeling fatigue, feeling depressed, they're getting sick more often, some infections, low-grade chronic infections, and difficulty to manifest intentions because the life that you attract is also of that kind where you're not able to manifest what you want. And these ama that is accumulating in the system, especially in the GI tract, it damages the integrity of your mucosal membrane in the gastrointestinal tract. And it causes increased intestinal permeability. We call it as a leaky gut syndrome. And now the absorption of poorly digested food component, it can be intermediate metabolites, it can be whole protein molecules, and is giving rise to a cascade of different terms that we coin. We can call it as candida, SIBO, intestinal dysbiosis, celiac, IBS. All of these are signs of ama, which is you're carrying pockets of incompletely digested food in your gut as well as in your cells and tissues. And now, because of this kind of fermented toxic residue which is stuck into your system, you're triggering immune inflammatory reactions within the intestinal mucosa, IgA, mast cell, histamine. It all leads to epithelial damage and further increased intestinal permeability where you're feeling even more sluggish and tired and bloated constantly. And it results into systemic chronic inflammatory conditions, hyperactive immune conditions, your gut is feeling bad, and your ENS and CNS is communicating all the time. So your enteric and the central nervous system is communicating all the time. So when you're feeling really bad at your gut, the way your nervous system behaves is also of that kind. So we see lots of these kind of conditions happening a lot with the kind of food that we eat, which is refined starches, refined flour, lots of dairy, lots of sugar, all those foods, and that is exactly what is happening. So when we try to break this jinx, one of the most effective therapeutic intervention that I do is fasting. I tell people, I myself practice this. So, and if you look at the current medical research, and we see that a lot in the headlines, that we see that there are lots of medical scientific benefits with a properly done fasting. When you do fasting, there's a genetic switch which gets turned on during fasting, which helps to stop inflammation. Fasting helps fatty liver disease, which is the non-alcoholic hepatitis. So you're having high levels of lipids and triglycerides, which is coming from fatty liver. Your routine periodic fasting is also good for your health and your heart at the same time, because in few days of fasting, you can actually start cleaning your arteries, coronary arteries. Fasting also triggers stem cell regeneration of the damaged old immune system. Your WBC gets a boost, so you are slowly recycling the old white blood cells and reigniting the new white blood cells, so your stem cells actually are working even more positively for your own immune system function. It's good for hypo as well as hyperactive immune system. Intermittent fasting also helps those with diabetes and cardiovascular disease, especially all leading to a metabolic syndrome. And this is a spectrum of disease when you're talking about metabolic syndrome, prediabetes, diabetes, cardiovascular disease. They are all on the same spectrum scale. So diet that mimics fasting appears to slow aging process, and it's seen in animals that they can actually expand their lifespan almost twice by intermittent fasting. And so we are actually really understanding the benefits of this and guiding our own patient population to encourage fasting and looking at their food and what are the times that they can really stay away from food. So when I wrote this book, Hot Belly Diet, one of the things which I said was a hot belly diet protocol, where at least one day a week what you're doing is a 24-hour fasting. And this 24-hour fasting is inconceivable for some people, where 24 hours no food. But when I explain them how you're going to do that, it makes a lot of sense, and many people are able to do that. So once a week, what you're doing is you're having a regular breakfast, whatever you eat in the morning. Then you're having a little bit late-ish kind of a lunch, which is around 1:30 or 2 o'clock. You have your lunch. And then that day you are skipping your dinner. Since you had your breakfast, you had your lunch, it's not difficult to skip your dinner that day. And then next day morning, you're skipping your breakfast and having an early lunch. And many people are easily able to do that. So what they're doing is they are slowly training their body one day a week to do a 24-hour fast from today's lunch to the next day lunch. They're easily able to fast. That's step one, where we tell them to do once a week. And the second step is to tell them that after 7 o'clock, you are trying not to eat any food. So you can have your regular breakfast, you can have your lunch, you can have your early dinner on everyday basis, where you should be done eating by 7 o'clock in the evening, and then up to 9 o'clock in the morning, you're not eating anything. So technically from 7 p.m. to almost 9 a.m. next day morning, you are having almost 14 hours of fasting on a regular basis. And somewhere close to 13 to 14 hours of fasting actually creates a resetting of your GI tract and digestion. In order to engage people initially, we can also use a technique which is called as water fast. And depending upon how many people are willing to do that, you can do a 3, 5, or 7 days of water fast. You have to assess their strength, their willingness, their mental power, and that is the most superior way of fasting, I would say. Because even when you do juice fast, which is good that you are squeezing freshly squeezed vegetable or fruit juice, drinking it as a liquid diet for 3, 5, 7 days, it still has an impact on your blood sugar, so it's considered not that superior compared to water fast, but it's still better than having several foods. The third one, which I also recommend quite a few patients of mine, is a mono diet fast, where they're having one decent meal in the middle of the day and having two super light meals, which is a super light breakfast and a super light dinner. Intermittent fasting, and this is becoming a real headline of how people want to fast and how they want to do this. So one of the things that I said in Hot Belly Diet was that you need to fast between your meals. So avoid snacking. And that's the first step when you want to encourage fasting, that you can have your breakfast, but you're not allowed to snack anything till lunch. And then from lunch to dinner, you're not allowed to snack on anything. And from dinner to breakfast, you're not allowed to snack on anything. So you're fasting in between breakfast to lunch, lunch to dinner, and dinner to breakfast. And you need to cultivate this habit on a regular basis. And it will actually stabilize your blood sugar level, and then we can make the right changes in what do you eat for breakfast and what do you eat for dinner. Lunch still remains the biggest meal of the day. When the sun is prominent in the middle of the day, that's where you should be eating the biggest meal of the day. The other option that we encourage people to do along with this fasting is selective food fasting. You're eliminating certain foods which are unhealthy from your diet. It could be wheat, it could be gluten, it could be dairy, it could be red meat. Understanding what is something which is not working or doesn't make you feel good or is an impure form of food. You're slowly minimizing those things, and you're encouraging to eat more of a plant-based diet which is healthy for them. Sensory withdrawal is also a good thing. During the fasting days, you are minimizing other things which are going to influence your thinking. So you're staying away from watching television or social media, going onto Facebook, or using your cell phone a whole lot during those times. It also helps you to be close to yourself. And actually, fasting has been used in all religious techniques around the world. You look at Christian tradition, you look at Muslim tradition, you look at Hinduism in the name of gods and goddesses. There are so many Hindu varieties in Jainism, in Sikhism. Even Buddhism is revered as a technique for enlightenment. And Gautam Buddha, who was the founder of Buddhism, actually fasted his way to enlightenment. So on the 14th day when he was enlightened, he was fasting with no food and water. And so there's a spiritual breakthrough that happens. And everyone has actually used these techniques of fasting to gain control and mastery over your mind and your life. So who should fast? From my perspective, being a clinician, light fast is good for everyone. I think once a week is excellent for digestive health. So we should all make a resolution, and it saves a lot of money and a lot of feel-good kind of a factor, because you are saving and allowing people to be fed in different parts of the world during that time. So it's really good for digestive health. It's not advised during pregnancy and breastfeeding. From an Ayurvedic perspective, it's good for all body types, I would say. For Vata people who are lean and thin, they can have a light fast. They actually cannot sustain a tremendous heavy amount of fasting. So they can fast on juices, soupy meals, and fruits. Pitta people who are a little bit more of an inflammatory type. Vata people are more of a degenerative type. Pitta people are more hot and fiery, so they have a little bit more heat and acidity, so they should fast on vegetable juices, which are mostly bitter and astringent. They can have some light fruits, they can have some broth, they can have some smoothies. And Kapha people, they are the strongest one and the heaviest one, so they are the retentive types, where they retain food and the water sometime. They should be drinking hot water, herbal teas, maybe clear broth. So all the different body types can fast. From age 13 to 60, I think they can all tolerate light fasting. Ideal time to fast would be spring and fall. You can actually mark your calendar around the spring and the fall equinox, where a few days before the equinox and few days after the equinox, you can actually fast, because that's when the season is changing. That's when the body is catch kind of off guard, where some of the imbalances, the diseases sets in. So that is a great time to fast. And we have so many cleanse protocols that we have. I have designed a kit called as a Purify Kit. That is a 7-day Purify Kit. There's a company called Rise and Shine, which is also good. And there are so many ways that you can fast during those things. You can do a plain water fast. You can do a juice fast. You can have a mono diet or a light fasting on that day. If you're suffering from a disease or a cancer or any heart disease, serious, you're taking medication, you should definitely consult your primary care physician before you do anything. So it should be done during medical supervision. During the fast, sometimes you're bound to feel some good and bad signs at times, which is invariably a sign from my perspective that you definitely need fasting. So when I tell people to fast and they experience hunger pangs or mild abdominal discomfort, weakness, lightheadedness, actually I tell them that you're on the right track, because these are what I call it as a healing crisis. And you do experience those initially during the stages of fasting. It could be cramps, it could be dehydration, feeling light sleep, you cannot sleep, maybe some little weight loss that happens in the first few days. So these are what I call it as a normal symptoms during fasting, but you should look for it and try not to do heavy-duty workout during those times, and try to really be a little bit more close to your own self to understand and have a sense of body awareness to understand and experience what you're experiencing during the fast. During the fast, the process it's a natural process of toxin excretion, so you are eliminating impurities and toxins. So you are getting rid of what is accumulated in the system, while the influx of the new toxins is greatly reduced because you're not eating anything. You're just hydrating yourself and you are purging things out of your system. This results into the reduction of a total body toxicity, and we all know now from a functional medicine point of view, and our friend Dr. Mercola talks really nice things about fasting, and there's lots of medical research that really claims that when you are having rampant toxicity in your system, it can lead to many diseases, including cancers of different kinds. So detoxification is always good, which is a natural phenomenon that happens during fasting. And the energy, what we usually use for digestion, is actually redirected to your immune functioning, cell growth, and eliminatory processes. So the technique that happens is called as autophagy. Autophagy is something your mitochondria or the cellular functioning is allowing it to reprogram itself. So it's allowing itself to renew and recreate and repair. The immune system's workload is greatly reduced, and the digestive tract is spared of any inflammation. So inflammation at the GI tract and the resetting of the microbiome is exactly the benefits of fasting. And any allergic reactions to food that you usually experience slowly gets mitigated or minimized as such. Many fat-stored impurities, there are water-soluble toxins which come out. There are fat-soluble toxins which also start coming out. So many fat-stored chemicals like pesticides and drugs are also released from your system. You start feeling really light and heal with a greater speed. You cleanse your liver, kidneys, and colon very quickly because these are all the organs of detoxification and elimination. You purify your blood during this time, and Dr. Colin Campbell, in his famous China study, actually clearly says fasting has been shown to be effective in treating prediabetes and metabolic syndrome. Helps you lose excessive weight and water, flush out toxins, clear the eyes and tongue, and also cleanses your breath. So there are so many things that we can talk about, the benefits of fasting. And as I said, it doesn't cost you anything. It's really giving you control and mastery over your functioning of the body. It makes you rejuvenated. The feeling, the look, the utility of the function, and the energy production, everything is one of the biggest symptoms that I see in my patient population is people complaining of low energy, feeling tired, feeling depleted, feeling fatigued. During fasting, initially you feel tired, but later you start feeling really greater energy, and the capacity is really visible through disappearance of many lines, wrinkles, blotches, pimples on the skin, pathological pigmentation, hyperpigmentation under the sky, under the eyes that you see actually starts getting better. The skin becomes much more youthful and acquires a better color and texture. Your eyes are clear, especially the white part of your eyes becomes clear and bright. You look definitely young and more vigorous, where you feel really energetic. You can actually erase several years from your life by doing a sustained intermittent fasting. The visible regeneration and rejuvenation on the eyes, skin, superficial tissues is allied to evidence of similar but invisible rejuvenation throughout the body. And it's not in a jerky way where you are doing fasting for about 2-3 days in a month or every 2-3 months, and then you're going to pig out on all the different foods, but you are slowly changing your relationship with the food by eating the right foods at the right time, in the right quantity, and fasting in between the meals and staying away from snacking and having long spells where you are just drinking water and staying away from food. That's exactly what I mean to say here by fasting. And we should slowly encourage this as a part of our daily eating. It's not that there's one day of fast and one day you are eating anything that you want. And lots of benefit, as I said, that it's a natural nutrition therapy where the body is actually doing something. And we're going to go a little bit more in detail exactly what is the process that happens in the body when you are going through the fasting process. So there's a resolution process of the inflammation that is going on. You actually give a break to your digestive functions so that all this thing is directed towards getting rid of the impurities. So you are healing so many things that are getting stuck in the body and realigning yourself. And you're actually feeling. So from an Ayurvedic perspective, when you reignite the digestive fire, what we call it is Agni, and you clear the srotas or the channels or the pathways, and the intelligence is able to flow. We call it as ojas, the vitality. And when the vitality is flowing in the system, you feel rested upon awakening. The skin has a healthy glow. The tongue is suddenly getting away from all the coated feeling. Your tongue is looking pink and clear. The body feels light, regardless of your weight. You feel centered and energetic throughout the day. Your digestion is strong without bloating or gassy or feeling sluggish. You feel energized and enthusiastic about everything in life, not only just the endurance factor, but your attention span, your cognition, your retention, your recall, your memory, your zeal of life gets better. Your mind is clear. Your body has a pleasant smell, and you rarely get sick because your immune system is functioning at its optimum level. So I'm really surprised, and all the ancient cultures actually use this to connect your spiritual health with your physical health and your psychological health together. We all know mind, body, and spirit, and the triad of mind, body, spirit gets completely integrated during the process of fasting. So let's go back and actually see what happens when you fast. So when you fast, say for example, you're fasting without any food and you're just drinking water all day long. So during the first 24 hours of a fast, there are some very profound changes going on inside the body. Within few hours, the glucose, which is circulating in your blood, is consumed. If that's not being replaced by food, then the body turns to glycogen. And glycogen is a stable form of glucose that is stored in your liver and muscles. And now the glycogen is being utilized. Only when that is gone, even that glycogen is completely gone and utilized, then you really switch on to what we call it as a fat burning. What actually happens is that the fatty acids are broken down in the liver, resulting in the production of ketone bodies. And these ketone bodies are now used by the brain instead of glucose as a source of energy. Because one of the biggest things that the body needs to do during fasting is to keep your brain ticking. And it cannot starve the brain without giving it necessary glucose. So initially is the circulating glucose, then is the glycogen from the liver and the muscles, and then it is the ketone. So you want to reach to the stage of what we call it as ketosis and a ketogenic diet. And it's something which you can slowly cultivate to be happening on an everyday basis, even when you're eating the right kind of food. So I would encourage people to actually fast on a regular basis, and we would like to see how fasting actually alters your hormone levels, gene expression, and cell metabolism and behavior. There's a lot of research which has come out that when you're fasting, There's more energy in the blood, glucose, fats, and ketones, and that triggers secretions containing hormones. So it actually allows those things to flow in the proper places. It travels through the bloodstream to the cells which are needing the energy. It activates the enzyme and regulatory proteins in the cell. Cell expresses differently if the genes, there's a change in that cell's energy requirement, and it activates building versus burning mode in the cell. So what happens is your body is very smart in order to really understand what is going on and start using it. Animals do it very easily and effortlessly. They go through hibernation. They go through long places where sometimes if you see an animal in the wild that is sick, actually it finds a quiet little place and allows itself to heal, and they starve themselves until the body starts feeling light. So fasting is one of the best way to really heal. Mahatma Gandhi, in his freedom struggle against the colonial rule in India, used this technique to reignite the spiritual and the moral strength. And he noticed multiple benefits that were happening in the body. The naturopathic schools, all the ancient cultures actually talk about the benefits, and this is exactly what we are seeing that is going on in the body itself. Because there's an energy transfer that needs to happen. You're walking around with pockets and storehouses of unwanted glycogen in your liver, fat, or muscle cell. And it allows to gives up this excess energy in the form of glucose or ketone when the insulin is low and the glucagon is high. So it allows that to go into the bloodstream, and then it is provided to your brain or heart cells, which needs the energy sources in the form of glucose or ketones, because it's always working. So you need to provide that source of energy that is happening. And I'm going to talk a little bit more about exactly how liver is an important organ, because it stores the fat, it regulates the fat, and release of that is actually really good. So when you're fasting, during the fasting body, glucagon signals, which are stored glycogen in the breakdown into sugars, which are either utilized by the cell or released into the bloodstream. When the glycogen is gone, stored fat breaks down into ketones, which are either utilized by the cell or released into the bloodstream. So we're actually looking at the ancient science that talks about the benefits of fasting and how the modern medicine actually seeing what is exactly going on in the body. So we all know in all the ancient cultures they talked about the benefits of fasting. We're also seeing that it has a powerful impact on your brain. The brain-derived neurotrophic factor is actually improved by almost 400% during fasting. So your brain is even more alert and more awake during fasting. And as I said, that we are not talking about fasting beyond without any food or any water or anything like that. You're hydrating yourself, you're fasting for 3 to 5, 7 days, and slowly cultivating the body to actually go long spells during the day without eating a lot of food. And initially practice somewhere close to 13 to 14 hours of fast on an everyday basis. And that is the why we use this term break fast, because you have to fast. You are understood that from sunset till 8 o'clock in the morning next day, you are fasting, and that's the reason why you are breaking the fast. So your brain and heart cell actually uses these ketones, which are used properly. So the insulin levels gets much more stabilized, the blood sugar level gets much more stabilized, and I think these are all unwanted benefits of unwanted effects of circulating fats and sugars can be completely lightened by using the fast. So lightening and fasting, they are synonyms, and the body feels really light and bright and open. So especially when I was talking about fasting in the hot belly diet, one of the simple principle that we say, and this is an action plan. So if at all you want to say what is takeaway plan from here, is number one is to avoid eating in between the meals. As I said, you eat your breakfast, but try to stay away from any food. You can have water in between, you can have some herbal teas in between, but stay away from any food from breakfast to lunch, and then from lunch to dinner, the same thing. So no snacking in between the meals. That's the first step. Secondly, look at what kind of waters that you are drinking. I call it as holy versus unholy water. So stay away from unwanted caffeine, sugary beverages, sodas, fruit juices. Go with something called as holy waters. So plain water, hot water, herbal teas, sipping hot water, reignite the fire, and actually it's like cleaning a greasy pan of your body. So the hot water actually gets the grease out. Make lunch as the main meal of the day. So if you consume about 70% of your calories before 3 o'clock in the afternoon, I think you're on the right track. Get rid of ama. There are some age-old Ayurvedic herbs that we use, and they are revered in Ayurvedic pharmacopoeia, Triphala and Trikatu, and they are easily available, good quality organic Ayurvedic supplements called organic Triphala and Trikatu, and you can take those on a regular basis using the spices and the spices for life. Hunger is something that you need to experience and mindfully enjoy the feeling of hunger as such. So you have to really judge whether you are thirsty or hungry properly, and that's exactly what is happening. You are doing the right exercise to improve circulation, to generate fire, and cultivating a positive mindset. Fasting is the art of metabolizing experiences. During that time, you're really burning away all the unwanted things that are stuck and blocked into your system. So fasting will reverse the digestive fire in your belly. So you're eating the right foods and drinking certain hot liquid that will feed and fuel your metabolism rather than slowing it down. So it will ultimately support your digestive balance and efficiency. You're fasting in between the meals for the sensation of hunger is absolutely essential for weight loss and overall health. New science shows that intermittent fasting can actually help you live longer and healthier life. We all know that. Making lunch as the most important meal of the day. So when the sun is the brightest in the sky, that's when your digestive system is fully awake. Now prove the new studies that we know now that eating more calories midday can actually result in greater weight loss. And late lunches and big dinners can be very detrimental to weight loss process, because when you have a big dinner late in the night, so when I was writing this book, one of the biggest things that I found was about 71% of Americans ate most of their calories after 3 o'clock in the afternoon. So when you eat a big dinner and you sleep after that, when you sleep, your heart rate, your pulse rate, even your metabolic rate slows down, and the food remains undigested in your system for a long time, and you wake up in the morning and you put another truckload of food on top of that, where you actually carry on this kind of a snowball-like effect of digestive stickiness or sliminess that gets accumulated into the channels. And another important concept is to clear out this tissue sludge, residue from poorly digested food that antagonizes weight loss, provokes hormonal imbalances, it triggers inflammation, autoimmune reactions, is the root cause of virtually all diseases. So you're following a very simple plan where you are encouraging fasting, you're drinking the hot liquids, and more importantly, you're doing a sustained amount of fast between 3 to 5 days with every change of season, at least twice a year during equinox in fall and spring. And more importantly, during the days of fasting, what you're doing is that you're really understanding that what are the benefits, how this fast can really change my life. Because when you're fasting, you will notice, and I notice a lot, where patients come back and they say that I really realize two things, that how little food I need to nourish myself. That's number one. And second, how good I feel when I'm feeling light and there is no real big amount of food sitting in my belly. How bright and clear and energetic and awake do I feel? So I think you don't need a whole lot of food to live longer. Those people who eat less food live longer and healthier life. And there are tremendous benefits of intermittent fasting that we talk about. Growth hormones get improved, the lipid profile is better, insulin sensitivity gets better, you start losing unwanted fat. Actually, you build the lean muscle mass if you're eating the right food at the right time. And most effective benefit of fasting is your willpower. Because willpower is something which is going to help you discern what is good for you and what is not good for you. In Ayurvedic terms, we call it Shreyas and Preyas. Preyas is something which is liked by your senses but may not be good for you. And Shreyas is something which is actually good for you but may not be liked by your senses. So you need to cultivate a habit of start liking things what are good for you. And that willpower, that discipline, and that patience, where you can stay away from food for that amount of time, will really make you feel stronger. And once you have this ability to control and regain mastery over your senses, you actually feel very spiritual. You have a spiritual insight where you are more close to your own self. You are having a state of mindfulness. You are having a state of body awareness. And then it actually makes you flexible and patient. And when I say flexible, means you are being kind and compassionate to others. It actually cultivates a greater resilience to difficult situations in life. And it paves the way for radiant health. So I definitely encourage all of you to embark upon fasting and making fasting an everyday part of your life, understanding the real benefits of psychological, physiological, and spiritual benefits of fasting, and how you can integrate different levels of fasting, whether it's water fast or juice fast or intermittent fasting or 13 to 14 hours of fast on a regular basis as a part of your everyday living. And I wish you all the best. And thank you, Corinne, for inviting me and allowing me to share this ancient Ayurvedic wisdom with American Nutrition Association.
Oh, Dr. Suhas, thank you so much. That was so engaging and informative. And I just have a couple of questions that I'd like to pose that have been previously submitted, and I've thought of a couple myself. The first is, what would you say to those of us that have some degree of hypoglycemia and really react poorly to a depletion in blood glucose? Is there a way to ease into it? I know you touched on that. Can you tell us how we might do that?
I think it's we call it as a reactive hypoglycemia because we train our body by eating certain foods and keeping the blood sugar at certain levels. And as we slowly start training it to stay away from certain foods, hydrating yourself properly, and I have told people that you just squeeze a little bit of lemon juice with some warm water and you drink it at that time, and it will still stabilize what you're feeling at that time. So most commonly, I'm not saying that you may not have hypoglycemia as such, but many of us actually have fluctuating blood sugars, which is coming from how we train by snacking the food at different time. We actually allow it to peak it up at certain time. So when we are slowly training our body, actually it will slowly disappear. So many times I tell this is exactly one more reason for you to do fasting because you have this reactive hypoglycemia.
So what you're saying is that as you ease into the fasting, the hypoglycemia symptoms will disappear over time?
Absolutely.
Oh, that's wonderful. That's great. And what would you, how would you steer our listeners to learn more about Ayurvedic types? Is that described in your book, or would you send us someplace else to
it's on my website on ayurvedichealing.net. I also have a simple quiz that people can go and look for their body types called as doshaguru.com. It's a website that we created, and they can look it up and take a simple quiz. They can also go to the Chopra Center website, chopra.com, and they have an excellent dosha-type quiz that you can take online, and it will give you lots of different options about how to understand your body type and select the right kind of fasting according to your body type.
Oh, that sounds wonderful. All right, let me repeat those. And so it's ayurvedichealing.net.
That's correct.
doshaguru.com. And chopra.com.
Yeah, chopra.com.
And those would be the three sites that our listeners can turn to learn what type they are and what type of fasting might be most appropriate for them.
Yeah.
Great. Okay, well, we've had some other previously submitted questions, but Dr. Suhas, you did such a beautiful and thorough job that you've answered all these questions throughout the presentation. So I would just again like to thank you so much for being here. And for me, as a clinical nutritionist, I have to say it's been really an enlightening evening. And we would like to invite our audience to find out more about your work, as I just mentioned, at ayurvedichealing.net. And good night and best of health to all of us.